So we have a very effective BCL2 inhibitor to treat CLL, which is Venetoclax. But one of the challenges with this drug is that it has a very difficult ramp up that takes about 5 weeks, and patients need to kind of be monitored very closely for lab abnormalities for tumor lysis syndrome during that time. So Lisaftoclax is a newer BCL2 inhibitor that's been found in early phase studies to have a shorter half-life than Venetoclax and to get up to a Cmax concentration faster. So this in theory should allow the drug to be ramped up more quickly, but still in a safe way. So in the study that I'm presenting at the ASH meeting, we're looking at Lisaftoclax with a rapid ramp up over just 5 days. And we're still monitoring the patients very closely for tumor lysis risk. And we've found that that is a safe way to ramp up this drug. So the study in total has 176 patients. It also includes combination cohorts. So in addition to Lisaftoclax monotherapy, there's a cohort combining this drug with Rituximab, and then a separate cohort of about 90 patients combining Lisaftoclax with Acalabrutinib, the BTK inhibitor. We've found good tolerability really across these cohorts. There were 5 cases of tumor lysis syndrome in the 176 patients, so it's about a 2.8% risk. These were mostly laboratory abnormalities that were easily managed. There were a couple of clinical cases of tumor lysis syndrome that were also manageable and did not require significant interruption of the drug, so these patients were able to continue on drug. From a safety perspective, the neutropenia rate seems relatively low. Even in the combination arms, no more than about 30%. We do see some of the gastrointestinal toxicities we expect with inhibitors of these pathways, diarrhea, some mild nausea, but a very tolerable regimen even in combination. From the efficacy perspective, Lisaftoclax on its own has good activity with a high overall response rate, but particularly when we combine with the Acalabrutinib, that's where we're seeing essentially 100% of the patients responding to the drug. And so it's a very effective combination. We've actually seen activity of the combination even in patients who've been refractory to prior Venetoclax or have progressed soon after time-limited Venetoclax-based regimens. So that's also very encouraging. And as we think about all the different drug-drug interactions that our patients may have, Lisaftoclax does not seem to have these drug-drug interactions either. So it makes it an easy drug to use for our older patients who may have a lot of other medications. So this early phase study that I'm presenting here at ASH has informed the design of the GLORA study, which is a randomized phase 3 trial comparing Lisaftoclax with Acalabrutinib to Acalabrutinib alone in patients who have already been on Acalabrutinib for at least 12 months. And the primary endpoint of that study will be a PFS comparison of those two arms, and it's actively accruing now at sites around the world.